Picture this. You're constantly exhausted despite getting 8 hours of sleep. Your memory feels foggy, and you experience strange tingling sensations in your hands and feet that doctors can't seem to explain. You've tried multiple B12 supplements, changed your diet to include more meat and dairy, but your blood tests still show low B12 levels, and your symptoms keep getting worse. What you don't realize is that having B12 in your system means nothing if your body can't actually absorb and utilize this critical vitamin, and the methods you're using might be completely ineffective for your specific digestive situation. What if I told you that 4 specific absorption tricks could dramatically increase your body's ability to utilize vitamin B12, potentially reversing years of deficiency symptoms? While 2 common habits you probably have are systematically blocking B12 absorption and guaranteeing that no amount of supplementation will ever work, I'm Dr. Grace Nakamura, a gastroenterologist with over 15 years of experience treating B12 deficiency, pernicious anemia, and malabsorption disorders, and today I'm sharing the exact protocols I use with patients whose B12 levels have normalized and whose neurological symptoms have completely reversed through targeted absorption. Optimization. Before we begin, if this information can finally solve your B12 deficiency and restore your energy and mental clarity, please leave your like down below. And if you want to receive reliable, evidence-based medical information about nutrient absorption and digestive health every week, subscribe to the channel and activate notifications. Now let's discover the 4 tricks that will transform your B12 absorption and the 2 habits that are sabotaging your efforts. The first B12 absorption trick is taking methylcobalamin or adenosylcobalamin in sublingual form rather than cyanocobalamin pills, which bypasses the complex digestive process that fails in most people with B12 deficiency. Most commercial B12 supplements contain cyanocobalamin, a synthetic form that requires multiple conversion steps in your liver and extensive digestive processing involving stomach acid, intrinsic factor, and healthy intestinal bacteria before it becomes bioavailable. Methylcobalamin and adenosylcobalamin are the active forms of B12 that your cells can use immediately, without conversion, and sublingual administration allows direct absorption through the rich vascular network under your tongue, bypassing the entire digestive system where absorption problems typically occur. The sublingual route can achieve absorption rates of 80 to 90% compared to less than 20% for oral cyanocobalamin in people with digestive issues. Place 2,000 micrograms of methylcobalamin under your tongue and hold it there for at least 10 minutes without swallowing, allowing maximum absorption through the sublingual capillaries. This should be done first thing in the morning on an empty stomach when blood flow to the area is optimal, and there's no interference from food or other substances. In my clinical practice, patients with severe B12 deficiency who fail to respond to traditional oral supplements often achieve normal B12 levels within 4 to 6 weeks using properly administered sublingual methylcobalamin. The second powerful absorption enhancement trick is optimizing stomach acid production through specific dietary and lifestyle interventions that restore the acidic environment necessary for B12 liberation from food sources and proper intrinsic factor function. Vitamin B12 bound to proteins in food requires adequate stomach acid to be released and made available for absorption, while intrinsic factor, the protein essential for B12 absorption, only functions properly in highly acidic conditions with a pH below 2.0. Many people, especially those over 60, have reduced stomach acid production that makes B12 absorption nearly impossible regardless of intake levels. To restore optimal stomach acid, consume 1 tablespoon of apple cider vinegar diluted in 4 ounces of water 15 minutes before meals containing B12-rich foods. The acetic acid in apple cider vinegar stimulates your stomach's own acid production while providing immediate acidification of gastric contents. Additionally, avoid drinking large amounts of water or other liquids with B12-containing meals, as this dilutes stomach acid and reduces the acidic environment needed for B12 liberation and absorption. Chewing food thoroughly and eating in a relaxed state also stimulates optimal digestive secretions, including stomach acid and intrinsic factor. Patients who implement these acid optimization strategies often show dramatic improvements in B12 absorption from food sources within 3 weeks of consistent application. The third B12 absorption maximizing trick is strategic timing of B12 supplementation in coordination with specific cofactor nutrients that enhance the absorption and utilization process while avoiding competitive inhibition from other vitamins and minerals. B12 absorption requires adequate levels of folate, vitamin B6, and magnesium to function optimally, as these nutrients work synergistically in the methylation pathways where B12 performs its essential functions. Taking B12 with these cofactors significantly enhances its bioavailability and effectiveness compared to B12 supplementation alone. However, B12 should never be taken simultaneously with vitamin C, iron, or copper supplements, as these can oxidize the cobalt atom in B12 and render it inactive before absorption occurs. The optimal protocol is taking B12 with folate and magnesium in the morning, separated by at least 4 hours from any iron or vitamin C containing supplements. Additionally, B12 absorption is enhanced when taken with a small amount of healthy fat, such as half a teaspoon of coconut oil or a few almonds, as this stimulates bile production and improves overall nutrient absorption in the small intestine. Taking B12 every other day rather than daily can also improve absorption efficiency, as the intestinal transport proteins responsible for B12 uptake become saturated with daily dosing and need time to regenerate for optimal function. The fourth advanced B12 absorption trick is addressing underlying gut health issues that commonly interfere with B12 absorption, including small intestinal bacterial overgrowth, candida overgrowth, and intestinal inflammation that damage the specialized cells responsible for B12 uptake. The terminal ileum, the final section of your small intestine, contains the only cells in your body capable of absorbing B12, and these cells are extremely sensitive to bacterial imbalances, fungal overgrowth, and inflammatory damage that can completely block B12 absorption, regardless of intake levels. Cybobacteria consume B12 for their own metabolism, creating a competitive situation where increasing B12 intake actually feeds bacterial overgrowth and worsens absorption problems. To optimize gut health for B12 absorption, implement a targeted anti-inflammatory protocol, including bone broth consumption, elimination of refined sugars that feed pathogenic bacteria, and strategic use of digestive enzymes that support proper protein digestion and prevent bacterial fermentation. Consuming fermented foods like sauerkraut, kimchi, or kefir provides beneficial bacteria that compete with B12-consuming pathogens while producing some B12 themselves through bacterial synthesis. Additionally, intermittent fasting for 16 hours daily allows the migrating motor complex to sweep bacterial overgrowth from the small intestine while reducing intestinal inflammation that interferes with nutrient absorption. Patients who address underlying gut health issues in conjunction with B12 supplementation achieve significantly higher absorption rates and more complete symptom resolution compared to supplementation alone. Now I must warn you about 2 habits that are systematically blocking your B12 absorption and guaranteeing that your deficiency will persist regardless of how much B12 you consume. The first devastating absorption blocker is the chronic use of proton pump inhibitors, H2 receptor blockers, or antacids that suppress stomach acid production and create an alkaline environment where B12 cannot be liberated from food sources or properly processed for absorption. These medications, including omeprazole, lansoprazole, ranitidine, and even over-the-counter antacids, like Tums or Rolaids, raise stomach pH above 4.0, completely preventing the acid-dependent processes essential for B12 absorption. Proton pump inhibitors also directly inhibit the production of intrinsic factor, the protein absolutely required for B12 absorption in the small intestine. Long-term use of these medications, even at low doses, creates a state of functional B12 deficiency that cannot be corrected through dietary changes or standard supplementation. The situation becomes even worse because these medications also impair the absorption of other nutrients essential for B12 function, including folate, iron, and magnesium, creating multiple nutrient deficiencies that compound the B12 absorption problem. I've treated patients who developed severe B12 deficiency and irreversible neurological damage solely from chronic antacid use, with some requiring weekly B12 injections for life because their digestive capacity for B12 absorption was permanently damaged by these medications. The second B12 absorption destroyer is excessive alcohol consumption, which damages the stomach lining, impairs intrinsic factor production, and directly destroys the intestinal cells responsible for B12 absorption while simultaneously increasing B12 requirements due to alcohol-induced oxidative stress. Alcohol acts as a direct toxin to gastric parietal cells that produce both stomach acid and intrinsic factor, progressively reducing their function with each drinking episode. Even moderate alcohol consumption of more than 1 drink per day for women or 2 drinks per day for men can significantly impair B12 absorption over time. Chronic alcohol use also damages the terminal ileum, where B12 absorption occurs, creating inflammatory changes that can permanently reduce absorption capacity, even after alcohol cessation. Additionally, alcohol metabolism generates acetaldehyde and other toxic metabolites that deplete B12 stores and increase the body's requirement for this essential vitamin, creating a situation where absorption decreases while needs increase. The thiamine deficiency that commonly accompanies alcoholism further impairs B12 absorption and utilization, as these B vitamins work synergistically in cellular energy production pathways. I've documented cases where patients achieved normal B12 levels within 3 months of complete alcohol cessation, despite years of failed supplementation while continuing to drink, demonstrating alcohol's profound impact on B12 status. Let me share critical information about absorption timing and enhancement strategies that can determine whether your B12 supplementation succeeds or fails. B12 absorption follows specific physiological patterns that must be respected for optimal results. The intrinsic factor-mediated absorption pathway can only process about 1.5 to 2 micrograms of B12 at a time, which is why megadoses of B12 are often ineffective when taken orally. However, there's also a passive diffusion pathway that allows approximately 1% of any B12 dose to be absorbed directly through the intestinal wall, which is why very high doses of 1,000 to 5,000 micrograms can sometimes overcome absorption problems through sheer quantity. The optimal absorption occurs when B12 is taken on an empty stomach in the morning, as this maximizes contact time with intrinsic factor and minimizes interference from other nutrients or medications. Additionally, B12 absorption is enhanced by maintaining proper hydration, as dehydration reduces blood flow to the intestinal villi where absorption occurs, while moderate physical activity after B12 administration improves circulation and nutrient uptake. Here's an essential medical consideration that could prevent irreversible neurological damage and identify serious underlying conditions. If you experience symptoms including severe fatigue, depression, memory problems, balance issues, numbness, or tingling in extremities, or changes in vision or hearing, you must seek immediate medical evaluation for comprehensive B12 testing, including serum B12, methylmalonic acid, and homocysteine levels. B12 deficiency can cause irreversible neurological damage if not detected and treated promptly, and some symptoms may not improve, even with adequate treatment if intervention is delayed too long. Additionally, B12 deficiency can be the first sign of serious underlying conditions, including pernicious anemia, Crohn's disease, celiac disease, or even stomach cancer that requires immediate medical attention. If you have a family history of autoimmune diseases, have undergone gastric surgery, follow a strict vegetarian or vegan diet, or are over age 60, your risk for B12 deficiency is significantly elevated and requires regular monitoring regardless of symptom presence. Never attempt to self-treat severe B12 deficiency without medical supervision, as some cases require intramuscular injections or high-dose IV therapy that cannot be achieved through oral supplementation alone. The fascinating science behind B12 absorption involves one of the most complex nutrient uptake processes in the human body, requiring the coordination of multiple organs, enzymes, and transport proteins that can fail at numerous points along the pathway. B12 absorption begins in the stomach, where hydrochloric acid separates B12 from food proteins, allowing it to bind with R proteins in saliva and gastric juice. In the duodenum, pancreatic enzymes break down the R protein B12 complexes, freeing B12 to bind with intrinsic factor produced by gastric parietal cells. This intrinsic factor B12 complex travels to the terminal ileum where it binds to specific receptors called cubolin and amnionless, allowing active transport into intestinal cells. From there, B12 binds to transcobalamin 2 for transport through the bloodstream to tissues throughout the body. This intricate process explains why B12 deficiency can result from problems with stomach acid, pancreatic function, intrinsic factor production, or intestinal health, and why simple supplementation often fails to address the root causes of poor absorption. I want to address a critical misconception that leads many people to inadequate B12 treatment and continued deficiency symptoms. The belief that normal serum B12 levels indicate adequate B12 status ignores the fact that serum B12 measures both active and inactive forms of the vitamin and can appear normal even when cellular B12 function is severely impaired. Methylmalonic acid and homocysteine are much more sensitive markers of functional B12 deficiency, as these compounds accumulate when B12-dependent enzymes cannot function properly at the cellular level. Additionally, the reference ranges for serum B12 are based on preventing severe deficiency diseases like pernicious anemia, but may be inadequate for optimal neurological and cognitive function. Many patients with B12 levels in the lower normal range experience significant symptom improvement when B12 is optimized to higher levels through proper absorption enhancement techniques. In my extensive clinical experience treating B12 deficiency and malabsorption disorders, I've observed that patients who implement these comprehensive absorption optimization strategies achieve dramatically better outcomes than those relying solely on standard supplementation approaches. Laboratory testing shows not only normalization of B12 levels, but also improvements in related markers including reduced methylmalonic acid and homocysteine levels that indicate improved cellular B12 function. Patients consistently report resolution of fatigue, improved cognitive function, elimination of neurological symptoms like numbness and tingling, better mood stability, and enhanced overall energy and vitality. Many describe feeling mentally sharp and physically energetic for the first time in years, with some experiencing improvements in symptoms they didn't even realize were related to B12 deficiency. Most importantly, patients who address absorption issues rather than just increasing B12 intake achieve sustained improvements that persist long-term, rather than temporary symptom relief that requires constant dose escalation. The key to achieving lasting B12 optimization is understanding that deficiency symptoms often result from absorption problems rather than inadequate intake, making it essential to address the underlying digestive and metabolic factors that prevent proper B12 utilization. Simply taking higher doses of B12 without addressing stomach acid production, gut health, medication interactions, and timing optimization often leads to continued deficiency despite seemingly adequate supplementation. This comprehensive approach to B12 absorption requires patience and consistency, as it can take several months to restore optimal B12 status and repair the cellular damage caused by chronic deficiency. But the results are typically dramatic and sustainable once proper absorption is achieved. I also want to emphasize the critical importance of understanding your individual risk factors and absorption challenges that may require modified approaches to B12 optimization. Individuals with autoimmune conditions, particularly those affecting the digestive system, may have permanently impaired intrinsic factor production that requires lifelong B12 injections rather than oral supplementation. People with extensive small bowel resection or inflammatory bowel disease may have insufficient terminal ileum function for normal B12 absorption regardless of optimization efforts. Additionally, genetic variations in B12 metabolism, including MTHFR polymorphisms, may require specific forms of B12 and higher doses to achieve optimal cellular function. Working with healthcare providers familiar with these complexities ensures that your B12 optimization strategy is appropriate for your specific situation and underlying health conditions. The connection between optimal B12 status and overall health extends far beyond preventing obvious deficiency symptoms, as this essential vitamin plays crucial roles in DNA synthesis, cellular energy production, neurological function, and cardiovascular health that affect every system in your body. When your B12 absorption and utilization are optimized, you often experience improvements in areas you might not have connected to B12 status, including better sleep quality, improved exercise tolerance, enhanced immune function, and more stable mood and cognitive performance. Conversely, suboptimal B12 status can contribute to a wide range of health problems that may not be obviously related to B12 deficiency, making absorption optimization a foundational aspect of comprehensive health maintenance rather than just treatment for specific symptoms. As a gastroenterologist who has dedicated significant focus to understanding and treating nutrient malabsorption disorders, I see daily how targeted absorption optimization can transform lives and resolve health problems that patients believed were untreatable or inevitable aspects of aging. I created this channel to share evidence-based protocols, clinical insights, and practical strategies that have restored optimal B12 status in thousands of patients with complex absorption challenges. Every week I provide scientifically validated approaches, detailed explanations of nutrient absorption mechanisms, and real-world guidance based on successfully treating malabsorption disorders in clinical practice. To access reliable professional medical information about nutrient absorption, B12 optimization, and evidence-based digestive health strategies, subscribe to the channel and activate notifications. Together we'll optimize your B12 absorption and ensure this critical vitamin can perform its essential functions throughout your body. Remember, B12 deficiency is often a problem of absorption rather than intake, and addressing the root causes of poor absorption is essential for achieving lasting improvements in B12 status and related symptoms. With these 4 powerful absorption enhancement tricks, and by eliminating the 2 habits that block B12 uptake, you're addressing the fundamental factors that determine whether B12 supplementation succeeds or fails in your specific situation. Your commitment to understanding and implementing these evidence-based absorption strategies will determine whether you achieve optimal B12 status and the energy, cognitive function, and neurological health that depend on this essential vitamin.